Hi, I'm Atlanta dentist Andrew Kokabi of Brookhaven Family Dentistry, and I'm coming to you live from the lovely waiting room of our dental practice here in the Brookhaven suburb of Atlanta. And today I'm going to answer a commonly asked question, and that is, does my old filling need to be replaced? We get a lot of patients in for second opinions in my dental practice because our dental practice has a reputation for being very minimally invasive and very conservative in our recommendations for treatment. We don't really want to drill on your teeth unless we need to. So we'll have people come into my office and often they will ask me, I've got all these old fillings and they're not bothering me, but I saw a dentist and they told me I need to have 5 of them replaced. Do I really need to have these fillings replaced? So let's dig into this and figure it out. First of all, let's do a quick rundown of what a filling is. I've got another video that goes into a greater explanation of this, but simply put, a filling is fake tooth structure. So if you've got tooth structure missing or it's rotten, then we'll replace that with fake tooth structure, which is a filling. There's a couple different kinds of fillings. There's white fillings, also known as composite resin fillings. These are the most normal type of fillings that are done. And the second type of filling is a silver filling, which are also known as amalgam fillings. We don't really do any silver fillings anymore. They used to be popular many years ago, but nowadays they're kind of obsolete, and most dentists do only white fillings nowadays. So that answers the question of what a filling is. Now let's get to the good stuff. Let's say you've got an old filling like this. Yes, it doesn't look great. It's worn down, kind of looks gross, but does this filling need to be replaced? Well, there's really no shelf life on fillings. There's no rule that says if you've had a filling for 10 years or 20 years that you must get that filling replaced because it's time for a new filling. They're not like tires on your car. So even though this filling is old and it's worn down and it's not pretty, I'm fine leaving this tooth alone because there is no decay around this old filling and it's intact. Nothing has broken off of it. So you've got a good filling, it's working, it's not bothering you. I don't want to open up a can of worms. I don't want to go and drill this filling out and put this new beautiful white filling that no one is ever going to see in your mouth. And then you come back and you say, well, doc, it wasn't bothering me before, but ever since you changed out my old filling and put a new filling there, my tooth has been kind of sore. Now, if I had a good reason to redo your filling, then okay, then it's worth it. But if I don't have a good reason to redo your filling, and I've redone your filling and now it's giving you pain and problems, then I've kind of done a disservice to you. So, some ways that I can tell whether or not your old filling is okay. One is x-rays. Fillings show up on x-rays and sometimes we'll see cavities underneath them. Other times, we just look at your tooth and we poke around at it. If I poke around at the border of the old filling and my instrument gets stuck between your old filling and your new filling, then I'm going to say, okay, hold on. This old filling is bad. It's problematic. You've got rotten and decayed tooth structure around it. You need a new filling. In that scenario, I feel great about replacing your old filling. But if I poke around and everything is solid and I don't see any signs of decay and nothing is broken, then yeah, we're fine not doing anything. So for me, and different dentists are different. If you ask 3 different dentists the same question, they'll give you 3 different answers. But in my dental practice, if the old filling is just old and worn down, that is not enough reason for me to replace it. I only want to replace your old filling if you truly have problems with it. And by that, I mean it is broken or cracked and decayed. And sometimes we can see that on the x-ray and sometimes we can see that inside your mouth. Now, let's say you do have an old filling that does have decay around it or it's broken off. And what happens if you do nothing? Well, cavities will develop. Tooth structure will become rotten. If you've got a little hole next to your filling and food gets stuck there, slowly it's going to start rotting out your tooth, and this decay is going to keep going and get to the nerve of your tooth. At that point, your tooth will become painful and you'll need to have it pulled or you'll need to have a root canal done on it. So that is the negative of leaving old fillings that have decay or broken parts around them, because cavities can develop and big problems can develop after that. That kind of answers the question of when you may need old fillings replaced. I hope that helps. Now, there are other scenarios such as cavities on teeth that have not been filled before. Broken chipped teeth may sometimes need fillings. There are things called abfraction lesions at your gum line that may sometimes need fillings, sometimes not. There's root canal treated teeth. So there's a whole bunch of other reasons why you may need fillings, and I have videos that explain these in greater detail. So feel free to check those out if you have questions about those scenarios. Well, thanks for spending the time to check out this video. Once again, I'm Andrew Kokabi of Brookhaven Family Dentistry. We've got not possibly, we definitely have the greatest dental office in all of Atlanta, all of Georgia, possibly the entire country. No, definitely the entire country. We've got the best dental office there is. We're got a lot of kind-hearted team members. We've got quality dental work that is done. Our hygienists are nice and gentle and friendly. And we do a lot for our community and the world. So yeah, I think we do have the greatest dental office in the entire country. So come and say hi if you're around. Hi, once again, I'm Atlanta dentist Andrew Kokabi of Brookhaven Family Dentistry, and I hope you enjoyed the video. If you did, do me a favor and click the thumbs up button on the bottom of the screen. Also, if you live in the Atlanta area, then congratulations, because you live in a town where we have hundreds of wonderful dental offices, and ours is certainly one of them. I will say this though, we are one of only 3 offices in the North Atlanta area that have not only a perfect 5-star rating on Google, but also have over 600 Google reviews. So I'm pretty proud of that. Anyway, yeah, feel free to give us a call or stop by and say hi. Thanks.